Why do communication breakdowns threaten operating room safety? Imagine a busy operating room where every second counts and teamwork is essential. When communication falters, it can create dangerous gaps in patient care. In the operating room, clear and accurate communication is vital for ensuring safety and successful outcomes. When team members do not share information properly, mistakes can happen that put patients at risk. These mistakes include operating on the wrong site, leaving surgical instruments inside the patient, or missing critical allergies or medical conditions. Such errors can lead to infections, complications, or even serious injury. Research shows that communication failures happen quite often during surgeries. On average, they occur every 7 to 8 minutes. In fact, up to 30% of interactions in the operating room may involve some form of miscommunication. This high rate of failure increases the chance of errors happening during the procedure. The operating room involves many different professionals like surgeons, anesthesiologists, nurses, and technicians. Each person has a specific role, and they must work together smoothly. When communication breaks down between these groups, misunderstandings become more likely, especially during complex or cross-disciplinary exchanges. There are many types of communication failures. Sometimes, key team members are not included in important discussions. Other times, information shared is incomplete or unclear. Poor timing of communication can also cause issues, such as when a team member is not informed about a change in the surgical plan. System-level problems like unclear policies or inadequate sharing of procedural details can make these failures worse. Environmental factors like loud noises, alarms, or distractions from technology can also interfere with effective communication, making it harder for team members to focus and share information. These failures are not just inconvenient, they can directly harm patients. For example, miscounts of surgical tools or sponges often happen because team members did not communicate properly. Such mistakes can lead to retained objects inside the patient, which may requiring additional surgery or cause infections. Distractions in the operating room, like noise or interruptions, can cause team members to miss important details or forget critical steps, increasing the risk of errors. To prevent these issues, many hospitals use structured communication tools like surgical safety checklists. These checklists help the team verify important details, such as patient identity, surgical site, and necessary equipment. They also promote team members speaking up if they notice something unusual. When used correctly, checklists foster teamwork and ensure everyone is on the same page, reducing errors and improving safety. Good communication should be maintained throughout all phases of surgery, from preoperative planning to postoperative care. Information transfer before and after surgery is just as important as during the procedure itself. In plastic surgery, where precision and aesthetic outcomes are critical, communication breakdowns can be especially problematic. Clear communication ensures that everyone understands the surgical plan, including patient-specific details like allergies or previous surgeries. It also helps coordinate intraoperative adjustments smoothly, which is essential for achieving the best results and maintaining patient safety. In summary, communication failures threaten operating room safety by increasing the risk of errors, delays, and adverse outcomes. To reduce these risks, healthcare teams should use structured protocols, minimize distractions, promote a culture of teamwork, and ensure continuous, clear information sharing. These practices are especially important in plastic surgery, where meticulous coordination directly impacts both patient safety and surgical success. Always remember, effective communication is the foundation of safe and successful surgical care. For personalized advice or specific concerns, it is best to consult qualified healthcare professionals.